We can bring not only our expertise from the App Center to the table, but also bring our students to the table to help problem solve. So not only are we servicing the community and helping them with their needs, but we're also helping students meet their learning objectives.
Our Trauma-Informed Schools Initiative is a newer program that we started as a pilot with 5 school districts within Southwest Virginia region, and we are working to help them become more trauma-informed and focus on resilience-based efforts within their classroom, developing positive, healthy relationships with students, and having a better understanding of what happened to students. Instead of taking an approach of what's wrong with students when they enter the classroom, trying to understand the path in which they come from. We are very fortunate to work with Dr. Shelley Coe's class as well as Dr. Sarah Fisher's class to help us both take a qualitative and a quantitative perspective on our project.
The fundamental part of this class, and that students have been researching different sites that have data related to trauma-informed teaching and have been pulling those sources and then creating a data set that we're going to give back to United Way using that data.
Our class, tied with the IRB, is doing focus groups with schools within Washington County. I believe 3 schools, 1 high school, 1 elementary and 1 middle school, to interview, do 1 interview and 3 focus groups to find out how within these climate teams these trauma-informed practices have been going.
We are hoping to be able to provide United Way an understanding of how the teachers and faculty and staff that they are working with, how they are responding to the process of bringing in trauma-informed practices into their schools.
They had to think about the types of questions they're going to ask.
So my questions are, what makes a community more likely to be an integrated support system for the students who live in that community? What sort of things indicate access to different levels of support? And then another thing is the inclusivity and broadness of those supports. So is every child able to access the same level and quality of services?
They also had to do a literature review and understand the research behind trauma-informed pedagogy.
The biggest challenge I've faced is just understanding where the teachers are coming from, where United Way is coming from, and kind of that communication difficulty that we've had, and understanding this is a real world experience and how that really goes into real world as we deal with people, and qualitative methods is people-based, and so that can be quite a challenge just to deal with people's schedules and coming up with what our end goal is and making sure that we're all on the same page.
I think that any time we can get the world into the classroom is a good thing.
So what I've specifically been working on is finding excessive drinking rates, alcohol vendor density, Medicare spending, number of mental health providers per county.
What excites me most about this work is that I haven't participated in being an interviewer before, in focus groups or in interviews, and also this topic is very heartwarming to an extent to find out what trauma children face.
Really, we're helping people.
And I actually get to take what I'm learning in the classroom and let it actually be useful to someone in the real world.
If we were doing a research methods class solely based on qualitative research that didn't involve a project and going out within the community, we wouldn't understand the full effect and the full influence of qualitative research.
I think that this opportunity both invests in Emory and Henry College's students, as well as takes a project that can then be expanded into additional school districts throughout Southwest Virginia.